first thing I'm going to do is I'm just going to explore the mobility in her hips. So I'm going to bring her leg up, and I'm going to put her in my holster right here. She's right on my hip. This is all completely hands-free. The most work I do is doing this, pressing buttons. This is the education of the future, pressing buttons. How's this? Is it too much in the adductors and the front of the hip? You get a pinch, anything like that? I'm gonna bring her up, and we've got enough tension that I can just hold her here, right? What I'm gonna do is come in and press on her adductors, and her external rotation is pretty developed. You see how this hip starts to come up? I'm using the legs as a handle to reach down into her pelvis and lumbar spine. But she can completely, your external rotation is great. I'm going to bring her up now and bring her over into internal rotation. When therapists see this, they think I'm just working on the legs. Do you see how they think? You're working on their ankle and their calf, right?
Such simpletons.
Like, oh, okay, he is kind of pressing on her IT band. I'm using the leg as a handle, and here's the deal. I'm working on a woman. I've mobilized her entire pelvis. All of this stuff down here, my hands weren't anywhere near there. How does this feel? Do you prefer this knee to opposite shoulder right here? Is that more effective than this?
No, I like that better.
You like that better? She likes this rotation. She's pretty open through here. I'm going to change this because I normally, on a mat session, I use my hand to do this. The reason I use my forearm is because my sky mat is high up off the ground, right? I've given her some hamstring length here, but where do you feel that?
All the way down to the glute.
All the way down into her glutes. I'm coming up and over, heel right in the center of my palm. My fingers are loose. How's that? There we go. I'm going to move my forearm just a little bit lower, just to anchor a little bit more deeply.
Okay.
And she's got good hamstring length as well. Her internal rotation is so far, I'm leaning to be able to get over there. I'm going to change this and bring myself over. Because I want to hook in right here. And then, how's this?
Oh, wow.
Where do you feel that? All down your leg. For someone with low back pain, it's very common for me to come in and reach and go, listen, right in here, right in there.
Ooh.
What'd you get? Pop. She had a spontaneous cavitation as I reached into this piece of her low back. Right in there. I'm also here to protect because she's not going to roll off the table. I'm right here to block, right? I take advantage of the fact that this is visual. This looks like Instagram to me. What do Instagrammers, what do people on Instagram want when they see your work? How's that? Too much? Now, from here, do you want a little more calf?
Ooh.
She's super malleable. I'm kind of adding a piece because she can receive more. Now I can grab here, and I'm checking here because I want to make sure she doesn't fall off the table. How's that? This completely changes the way that I'm interacting with tissue. Now, we worked on one side. I want you to, I call this Vegas. Can you lift this leg and like move it around? Bigger. Now, Vegas with the other leg. Feel different? She didn't have a problem, but it did increase range of motion through that area. How many times did I spend pressing with my hands? There was a lot more pull than push. Take advantage of the fact that it's very visual. Show it off. Show people what you do. Make Instagram videos. Talk to them. Listen, you got low back pain? Well, I'm going to hook you up. You got low back pain? How's this? Cool. Not too much? And I'm going in a little slower because she was, you know, she's cold on this leg, I guess you'd say.